Hi there, my name is Dr. Lawrence. I'm a chiropractor here at the Deering Clinic, and today I'm going to be talking to you a little bit about headaches. There's so many types of headaches out there. There's going to be things like the tension type headache, cluster headache, cervicogenic headache. That list kind of goes on and on and on. Well, today I'm going to be talking to you about the three most common types of headaches that we see here in the office. These are going to include the tension type headache, the cervicogenic headache, and the migraines. So a tension type headache is going to be a headache that's a referral from the muscles within the neck and the upper back. We start to see these muscles go under high levels of tension under times of stress, when these muscles aren't being utilized properly, or there's these patterns of muscular involvement where it shouldn't be activated, but it is. It's almost like a compensatory mechanism. So under times of stress, you hear people say all the time, I carry my stress in my traps. And that is true. A lot of people do when they feel stressed or they're unsure of what's going on. They tend to hike their shoulders up a little bit. Even sitting here now, just think, are your shoulders nice and relaxed and settled? Probably not. As we carry that stress or that tension within our shoulders, what can happen is these muscles get tight. They're not able to work quite properly. When that occurs, muscles can start to send referrals to the head, causing a headache. There can be trigger points within those muscles. On top of that, we look at posture as a big contributor to these tension type headaches. Now, in today's day and age, a lot of people are on their phones, they're on a computer, and what happens is you get this head pitched forward and those shoulders rolled forward position. For about every inch that head is moved forward, it places an additional 10 pounds of stress on the muscles that have to hold up your head. As this goes on for an extended period of time, what happens is these muscles begin to fatigue. They're not able to work properly. We start to see this referral pattern from the neck, from the upper back into the head, causing these headaches. There's many things that we can do here in the office to address these symptoms. I'm going to address all of this at the end. First, I wanted to discuss the types of headaches. I'm going to discuss a cervicogenic headache. What this means is that the headache actually stems from a dysfunction in the movements within the neck. The neck is supposed to have a great range of motion. You should be able to look every which way, and there shouldn't be any pain, stiffness, tightness. But as we age, as we go through traumas such as car accidents, falling off a horse, all of these different types of things, we can start to see degeneration occur within the neck, or maybe these joints just aren't functioning quite optimally. When that occurs, that neck can start referring pain to the brain and to the head, saying, wait a minute, something's not right here. So, with that being said, we want to ensure that we're moving that neck through a full range of motion, ensuring that those joints are able to glide along each other properly. Finally, I'm going to talk a little bit about a migraine. Migraines are another common type of headache that we see here in office. And now, like I said before, there are two types of migraines. There's going to be a classical migraine and a migraine with aura. They're essentially the same type of headache, but a migraine with aura has these visual disturbances that are going to occur about 20 to 30 minutes prior to the onset of that debilitating headache. One thing that we do when we're looking at the types of headaches is we can review the types of symptoms associated with each headache and how you present with those symptoms. So for example, when we're discussing a migraine headache, things we know to look for are that this headache is going to be pulsatile. You're going to feel this throbbing or this pounding inside the head. It's typically only going to be on one side of the head. So we look for this unilateral symptom. We're looking for this nausea, vomiting that sometimes occurs. We're going to be looking for this debilitating type headache where it's tough to get out of bed. Other things that we can look for as well: light sensitivity, photophobia, any sound sensitivity, phonophobia. Again, all of these symptoms are going to help guide us to the type of headache that you have and what we can do for treatment, because each type of headache is going to have a different type of treatment. Now, when we're talking specifically about treatments for these three types of headache, we're going to look at the tension type first. Now, as I said before, a tension type headache is going to be coming from the muscles within the neck and the head. So things that we can do for this are going to be to actually work on those muscles, to remove any of the trigger points, to remove any adhesions within those muscles, and to allow those muscles to function properly. We can do that either with our hands manually. We can get in with trigger point injections, where we can inject a solution into those trigger points, which acts almost like a lubricant. It allows them to glide, all the fibers to glide properly on one another. We can also do some exercises that are going to strengthen up those weak muscles. There's not going to be any kind of compensation going on, and again, relieve some tension, causing a tension type headache. Now we'll talk a little bit about a cervicogenic headache. Cervicogenic headache, as I said before, was going to be that dysfunction within the joints. You're going to lose some range of motion. You're going to feel maybe a little sharp tweak through the range of motion. And there's things that we can do for that specifically as well. One of which being a chiropractic adjustment. When we get in and we do a high velocity, low amplitude thrust, where we're just going to move that neck a little bit, you may or may not hear a cavitation. But what's going on is we're allowing those joints, or we're assisting those joints to get through a full range of motion that they may not have been able to go through before. Once we maintain that new range of motion, we see a lot of reduction in pain because there's no more dysfunction. with that dysfunction, we saw that referral of pain from the neck into the head. So again, we have specific tests that we're looking for to determine what kind of headache it is. Finally, with a migraine, we can do several different things, including giving you nutritional advice. There are certain kinds of foods that may trigger migraine. All of these little things that you can be aware of that you just may not know of. We're more than happy to and want to help you get to the bottom of these headaches. So if you have headaches, you're not sure what kind of headaches they are, you're looking for some relief, please don't hesitate to give the Deering Clinic a call, shoot us an email. We're more than happy to help schedule an appointment, get to the bottom of your problem. Thank you so much for your time. We'll talk to you soon.